Paranoid personality disorder. The best treatment options. Paranoid personality disorder is a type of eccentric personality disorder. An eccentric personality disorder means that the person's behavior may seem odd or unusual to others. An individual with paranoid personality behavior is very suspicious of others. They mistrust the motives of others and believe that others want to harm them. Other hallmarks of this condition include the reluctance to confide in others, bearing grudges, and reading demeaning or threatening meanings in even the most innocent of comments or events. A person with PPD can be quick to feel anger and feel hostile toward others. PPD usually appears in early adulthood. According to the Cleveland Clinic, PPD appears to be more common in males than females. Treatment for PPD can be challenging because the individual with PPD has intense suspicion and mistrust of others. A mental health professional must establish trust with the patient. This trust enables the patient to confide in the professional and believe that they have a disorder. Causes of paranoid personality disorder. The cause of paranoid personality disorder is unknown. However, researchers believe that a combination of biological and environmental factors can lead to paranoid personality disorder. The disorder is present more often in families with a history of schizophrenia and delusional disorders. Early childhood trauma may be a contributing factor. Symptoms of paranoid personality disorder. Often people with paranoid personality disorder don't believe that their behavior is abnormal. It may seem completely rational to a person with PPD to be suspicious of others. However, those around them may believe this distrust is unwarranted and offensive. The person with PPD may behave in a hostile or stubborn manner. They may be sarcastic, which often elicits a hostile response from others, which in turn confirms their original suspiciousness. A person with PPD can have other conditions that can feed into their PPD. For example, depression and anxiety can affect a person's mood. Mood changes can make someone with PPD more likely to feel paranoid and isolated. Symptoms include believing that others have hidden motives or are out to harm them, doubting the loyalty of others, being hypersensitive to criticism, having trouble working with others, being quick to become angry and hostile, becoming detached or socially isolated, being argumentative and defensive, having trouble seeing their own problems, having trouble relaxing. Some symptoms of PPD can be similar to symptoms of other disorders. Schizophrenia and borderline personality disorder are two disorders with symptoms similar to PPD. It can be difficult to clearly diagnose these disorders. Paranoid personality disorder diagnosed. Your primary care provider will ask you about your symptoms and history. They'll also do a physical evaluation to look for any other medical conditions you may have. Your primary care provider may send you to a psychiatrist, psychologist, or other mental health professional for further testing. The mental health professional will perform a comprehensive assessment. They may ask about your childhood, school, work, and relationships. They may also ask you how you would respond to an imagined situation. This is to gauge how you react to certain situations. For example, they may ask what you would do if you found somebody's wallet on the sidewalk. The mental health professional will then make a diagnosis and form a treatment plan. Paranoid personality disorder treated. Treatment for PPD can be very successful. However, most individuals with this condition have trouble accepting treatment. To a person with PPD, they don't see their symptoms as unwarranted. If an individual is willing to accept treatment, talk therapy or psychotherapy are helpful. These methods will help the individual learn how to cope with the disorder, learn how to communicate with others in social situations, help reduce feelings of paranoia. The outlook depends on whether the individual is willing to accept treatment. Individuals who accept treatment can hold down a job and maintain healthy relationships. However, they must continue treatment throughout their lifetime because there's no cure for PPD. Symptoms of PPD will continue but can be managed with care and support. People with PPD who resist treatment may lead less functional lives. PPD may interfere with their ability to hold down a job or have positive social interactions. Treatments. Treatment of paranoid personality disorder can be very effective in controlling the paranoia but is difficult because the person may be suspicious of the doctor. Without treatment, this disorder will be chronic. Medications and therapy are common and effective approaches to alleviating the disorder. The social consequences of serious mental disorders, family disruption, loss of employment and housing, can be calamitous. Comprehensive treatment, which includes services that exist outside the formal treatment system, is crucial to ameliorate symptoms, assist recovery, and, to the extent that these efforts are successful, redress stigma. Consumer self-help programs, family self-help, advocacy, and services for housing and vocational assistance complement and supplement the formal treatment system. Consumers, that is, people who use mental health services themselves, operate many of these services. The logic behind their leadership and delivery of these services is that consumers are thought to be capable of engaging others with mental disorders, serving as role models, and increasing the sensitivity of service systems to the needs of people with mental disorder. Psychotherapies. Psychotherapy is the most promising method of treatment for paranoid personality disorder. People afflicted with this disorder have deep foundational problems that necessitate intense therapy. A confident therapist-client relationship offers the most benefit to people with the disorder, yet is extremely difficult to establish due to the dramatic skepticism of patients with this condition. People with paranoid personality disorder rarely initiate treatment and often terminate it prematurely. Likewise, building therapist-client trust requires care and is complicated to maintain even after a confidence level has been founded. The long-term projection for people with paranoid personality disorder is bleak. Most patients experience predominant symptoms of the disorder for the duration of their lifetime and require consistent therapy.